G'day everyone and welcome to Life in the Peloton. I'm Mitch Docker and I've got Lionel Burney here joining me this week to introduce this week's episode. G'day Lionel, how you doing mate?
I'm good, thanks Mitch. I'm out of quarantine after my trip to the Tour de France. I had 2 weeks in which I wasn't allowed to leave the house and it was a long 2 weeks I have to say, but I'm free now, free as a bird.
Well good mate, you did tell me that there was a possibility that you were going to go to the Giro, and then I thought about it and I was like, oh hang on, that's another 2 weeks quarantine after that as well, and then the Vuelta another 2 weeks, so it's probably maybe changed your decision about that.
It has a bit, yeah, but I gather you are off to Spain well, you're in Spain anyway, but you're off to the Vuelta in a couple of weeks' time. Is that right? That's how things stand at the moment.
That's right, yeah. So it's going to be the last race of the year, and it's one of my favourites. I've sort of ticked that one off a few times before. It's going to be a hell of a lot different this time. No heat, and more or less running into Christmas Eve, but nevertheless, it's another race, and I'm looking forward to getting a big race in my legs before this season finally finishes. But before we get going, I have to introduce this episode. I've got Dr. Kevin Sprouse, who's the head team doctor on EF Education First. He's an American, a great guy, and it'll sort of be great to sit back and have a chat to him about the ins and outs of the daily job of a team doctor. But also, I wanted to get some tips off him, some tricks of the trade. So I got everyone to send some questions in and I formulated sort of some questions myself. So I hope you enjoy this one, guys. Sit back and enjoy Dr. Kevin Sprouse. Well, welcome everyone. Life in the Peloton, and this time I've got the team doctor, Kevin Sprouse, a good friend of mine actually as well. Welcome to the podcast, mate.
Hey, Mitch. Thanks for having me. It's good to be here.
Mate, I've been very impressed. I've been listening to your podcast the last few weeks, and it's been like we haven't seen each other all year. You've brought out a podcast over the lockdown, and the best part about it was I could just sit back, listen to your voice, and it feels like we haven't missed each other for however long it's been.
Well, likewise, maybe I sit back and listen to yours a little bit, you listen to mine. It has been weird, the fact that, I've been with the team for a while now, and never have I been away from racing and away from you guys for such a period of time. Living in the US, I'm not able to get over. We have had doctors at the races, but I've not been able to be there, and that's been really strange for me. So it's good to talk to you face to face, kind of.
Well, let's get into it. Today we're going to talk all about your job and what happens on the race, because I think what I try and do in this podcast is just try and get into all the little different jobs that everyone does, aside from the cyclists, of course, because I just find it so fascinating that there's so many little different jobs that no one knows about, and even myself don't 100% know exactly what your whole job is. So to start off, you're the team doctor with us on the World Tour team. You started back with a development team of Slipstream back in 2010 and then merged across into this team, which was Chipotle, then became Cannondale, which is now EF. What I want you to do is just tell us a little bit about your background, maybe blow out the myths of what a team doctor is on a World Tour team and what your story is, how you've come to doing this job today.
Yeah, so my background is pretty varied. I did undergraduate studies in exercise science, then went to medical school, and every country trains doctors a little differently, but the way it is in the US, you go to medical school, and then you go do specialty training called residency. And so I did a residency in emergency medicine, and then I went back and did a subspecialty fellowship training in sports medicine. And so my background is exercise physiology, emergency medicine, and sports medicine, which is fairly comprehensive when it comes to being on the road with you guys.
Was there always that desire to get on the road as a cycling? Why cycling? What's your background there?
Yeah, so I got into cycling while I was doing my, actually in medical school. I did a little bit of triathlon before going to medical school, and then in medical school, it's a 4-year process in the US, and after 2 years, I was fat. I mean, it was not pretty. I weighed about 105 kilo, and I just sat around and studied all the time. And a couple of my professors came to me and a couple of the other guys who had been active and kind of let it slip, and just basically told us to get off our asses and come on. We were going on a bike ride the next day. And they got us back on our bikes, mountain biking, road riding. As my medical career proceeded, when I was doing residency, I was actually watching the Tour de France one day, just, as a fan from the TV, and they did an interview on the guy who had my position in this team before me. Prentice Stefan was our head doctor before I was. And it talked about his background, and I actually hopped on the website, the team website. It had his email on there. I emailed him, and I was like, how in the world did you get this job? This sounds so cool. And so from that point on, I kind of set it in my head that it would be very cool to do this, although I didn't think I'd get the chance because lots of people are trying. But I was kind of like, if I can at least kind of move that direction, something fun will happen out of that.
What did it appeal to you just from that one interview that made you think, I want to do this? Obviously, there was a sporting side. You were doing a bit of writing yourself, but why not go down another sporting line, say, American football or even baseball or whatever that is? You could be around home. Was it the travel? Was it to the excitement of racing? Did you know a whole lot about the job from just that one interview?
No, I didn't know.
Yeah.
I think what drew me to it was two things. One, when you're watching the Tour de France, the travel just looks amazing and romantic, and you're in these incredible places. They don't show the crappy Kyriad hotel that you're staying in, the terrible food, the way it really plays out. It's an amazing thing to do, but you definitely get a colored picture of it. But there was that aspect of it, and then there was the whole human performance side. And coming from exercise science, that just fascinated me. So you guys in cycling probably have the most objective data around your performance. There's power meters, heart rate meters. We've got GPS data. In other sports, that's coming along, but it's not quite to the same degree. And so having that background, I had a natural curiosity in the performance side of it. And quite honestly, in that interview with Prentice, the team, this Slipstream program, what's now EF, had just come out into the World Tour and was taking that step to do it in a clean way. Not that everybody else wasn't clean. We know there was plenty of doping and everything else, but they were just forthright with they're going to do it clean and see what happened. And that very much appealed to me too, because I wouldn't have any interest in doing it otherwise. And so that trifecta of interesting travel, amazing performance medicine, and knowing that there wouldn't be some untoward pressure on me to do stuff I wouldn't feel comfortable, it just sounded like a fantastic possibility. Well,
let's get to the actual reality of it. I want you to explain to everyone now that you've got the job, now that you've had some, many years in the job, getting used to it, move to the head doctor. What's the day-to-day of your job like in terms of when you're on the race, day-to-day, but when you're back home? Because we have a lot of communication. There's quite a lot of organising, looking at certain tests. Run me through what it is you do.
Yeah, so if we look at it kind of on a calendar basis, in the early season, there's a bunch of tests that you guys have to do as mandated by the UCI, stuff that we would be doing likely anyway, but it's a requirement that we have to tick. So you're doing cardiac tests, you're doing blood work, pretty extensive panels of blood work that all gets fed back to me in my office. I've got a guy who works for me who one of his side jobs I've assigned to him is he puts it all into a system that follows all this blood work and trends it. And you can imagine with 28 or 30 riders, that's an extensive amount of information that comes flowing in on top of helping you plan and schedule these tests often. So early season, we're compiling all that Q1, that first quarter data that we have to get. And then somewhere in there's usually a training camp where I and or one of the other doctors meets individually with each of you and just goes over a medical history, anything, since we last saw you. New riders get a little extra time, but just as you would with your doctor back home, just kind of trying to get a feel for what medical issues you're dealing with, if any, past injuries, family history, all that stuff. Once we get out on the road, the day-to-day looks a little different. Right? So that's more of the clerical stuff that happens away from races. I mentioned that was first quarter testing. We do quarterly testing for the UCI. Fourth quarter testing is due now. Don't forget.
Thank you, actually, yeah.
Some people are better at remembering to do that than others. But again, so every quarter we've got this flow of information that comes in from you guys doing your testing, and we have to compile that, look at trends, make sure nothing looks worrisome, first and foremost from a health standpoint, but also just from in terms of supporting performance. little things like vitamin D or iron levels. We say little, but it's a big deal when you're doing what you guys are doing. So we try to keep an eye on all that stuff.
Before you go on, just talk about these quarterly blood tests, because I think this is quite interesting anyway for me, that you're just one thing just alerted me there. You've got the general range of a healthy person. I think that's important that we are inside that range, obviously, first. But one thing that I guess I always look for is to be at the very top of a certain range, whether it's an iron level or... Because that's the cycling side, the professional sports side of things. If I can have it in that range, sure, I want to be pushing the very limit of it. Is that... When you said then you want to be supporting us for the performance, is that something how you look at the range? For instance, we're in a healthy range for a normal human being, but we want to see you at the very top of that range, whatever that may be, or at the very bottom, say.
Yes. So when we look the various metrics that we gather from blood work, the ranges that we set, first and foremost, there's kind of a very wide range that says, are you diseased or not?
Yeah,
right?
Okay.
Is there a medical problem? But then we tighten that based on the literature to know where performance is optimized. So with iron, for instance, if your ferritin level is 10, that's problematic across the board. But if it's 30, you're not diseased, but you're probably not going to support the level of training and just kind of exercise load that you guys put on yourselves. So then we're looking for considerably higher levels. And with you guys, there's a lot of that, moving the goalpost, so to speak, making sure that we get you in a place that is suitable for what you're attempting to do. Now, that doesn't always mean it's different than the standard range. Sometimes it's not. And it doesn't always mean more is better. There's a curve. So we try to figure out where on that curve we want you guys to, first and foremost, keep you healthy through the season. Because in my opinion, it's really about resilience. You guys race so many days. Sometimes, even with training load, you can go over just a little bit and maybe harvest a little bit of increased performance, but then you sacrifice a lot beyond that because you can't keep that up. And so it's almost, for the majority of the season, it's probably best to be at about 95 to 98% and be able to turn it up when you need it and then back off again. So we want to support that 95%, so to speak, that rate that's maintainable through the year.
And what are some common things that you would say for us? Like, are there a few things that are pretty commonly needing assessment or help with? Like, for instance, you mentioned ferritin. That's something that, for me, is often lower because I'm getting fatigued. I'm going to altitude. I'm not absorbing the iron levels that I need to keep that up. That's just one thing for me. Is that a common thing between all of us? Are you seeing common trends between cyclists, or is it really just a mixed bag when it comes to pro cyclists?
It's a mixed bag, but there are themes. So there are kind of groups that we see people fall into, and having lower iron levels is fairly common. Now, not so low that it's a massive problem, but low enough that we know we need to stay on top of supplementation. Making sure that your diet is rich in iron and that maybe you're taking an iron supplement as well. Nothing crazy, but just knowing that it's there, because if we get behind on that and iron dwindles, it's really difficult to supplement and bring that up during the season when training load is high. We want to make sure that we kind of have you go into the season in a good place and just maintain through the year. It's not more is better. It's just keeping you in a reasonable range. Vitamin D is another one that you guys probably hear us harp about, that it seems like it's a minor thing, but vitamin D is important for muscle function, muscle recovery, immunity, which has been very important this year. And is important really any year, because the risk of colds and upper respiratory stuff during the season is fairly high. So things like that we keep an eye on. It's not super sexy, but it's the basics, the foundational stuff.
Is that something that gets you excited when you see a good lot of blood work come in and you're like, oh, wow, this guy is, well tuned. This guy's got a good engine. Like, it doesn't necessarily replicate to what he does on the bike, but that is a good machine there. Do you like seeing that stuff?
I do, and I think that probably makes me kind of a geek, but it's fascinating to me. And then even more than just a snapshot of one time, one panel of blood work, but seeing somebody's play out over the year or even a few years, that really fascinates me. What
about on the other side, when you just see like, whoa, this thing's like a bloody rusted out old car, and you see them, right at the front of the race, you're like, amazing.
Oh, for sure. Yeah. We're often reminded that winning and losing isn't just about the numbers on blood work or the numbers on your power meter or anything else. Like, there's a lot that goes in there. And so I've learned with all of my athletes, cycling or otherwise, to tell them the stuff that we're doing around, diet and nutrition and recovery and everything that might make those numbers look better on paper. The goal is really to make it so that your training can fall on the firmest foundation possible, so that the work you put in is going to get you the most benefit. Not that you're bound by, your iron level or your power meter numbers that week. It's so much more holistic, isn't quite the right word, but it draws on so many more aspects in that. But unless you have those basics really tuned up, then you're leaving some performance on the table. That's what we want to make sure. And then, like I said, make sure that you have a season that is as consistent as possible. Not that you have a couple of shining moments and then the rest is kind of a struggle. It's about keeping you healthy and primed for the whole year.
Chute à l'arrière du peloton, cycling podcast team car at the back of the pack, please.
That's said PK, the voice of Radio Tour at the Tour de France, interrupting Mitch's conversation with Dr. Kevin Sprouse to remind me to tell you that this episode is sponsored by Babel. Now, have you wanted to learn a second language or another language, whether it be French or Spanish or German or Italian, or one of the 14 languages that you can learn using Babel? Well, if you'd like to learn a language, Babel is offering 6 months free with a purchase of a 6-month subscription if you use the promo code CYCLE. So what is Babel? Well, basically it's a language teacher in your pocket. You can use it on your phone or on a computer, and as you go through the course, ticking off the short daily lessons, which last about 10 or 15 minutes, you can sync across different devices. So if you find you've got 10-15 minute wait for a train and you want to quickly do a language lesson, you can just pull out your phone and get stuck in. And Babel uses real life conversations to teach you the language, because the different lessons have been designed by real people, and so you get started using phrases and simulating situations that you would actually find yourself in. The technology also helps you work on your pronunciation, something that I certainly need to work on. The speech recognition technology helps you improve by repeating back to your device and giving you the thumbs up if you got the pronunciation right, and giving you another go if you didn't. Now, the teaching method has been proven to be effective across multiple studies, and as I say, it's available as an app or online. And if you would like to learn one of those 14 languages, go to babbel.co.uk/play. That's babbel.co.uk/play, and use the promo code CYCLE. The details are in the show notes too. Now back to Mitch and Dr. Kevin Sprouse.
Let's go back to the day-to-day, because I think this is quite interesting for me, and this is what I get to see what you do. Run me through, once you get to the race, how does it go from there? What's your mindset there?
Yeah, so if we look at a day at the race, I usually wake up pretty early, a good bit earlier than you guys, because I like to get a run in. And so I'll start my day, I'll go for a run, and I need to be back at the hotel before any random testing might happen, right? So on a race.
Yeah, right, that is early then.
It is, and this is something I've learned through the years, right? That, at any given race, the testers may or may not show up in the morning. They usually show up within a given time window. Not always, but you can kind of guess when they're going to be there. 7 to 9, somewhere in there, 7 a.m. to 9 a.m. So I'll often go for a run at 5:45 or 6, and then come back just so that if that happens, I can be there to accompany you guys, which is just kind of standard. That's what happens across all teams, that the doctor accompanies you. You don't need us there typically, but it's just kind of the way it works out. So I'll go for a run, be around the hotel, have some breakfast, and oftentimes just kind of be around while you guys are waking up. Sometimes that's in the breakfast room. Sometimes I'll just walk through a couple times. My goal is always to be accessible without being on top of you guys. That if you need me, I'm either in the room, down the hall, like where I am, or I'm very easily found. but that I'm not just like constantly asking you, are you okay? Are you okay? Because I think that gets just as annoying and in your head. So my morning will kind of be like that. I'll ride to the race with you guys on the bus most of the time, again with that in mind, so that if there are some conversations to be had, if the knee's bothering you a little, your digestion's off, whatever, I'm right there, but I'm also not like in your face about it. You just have to kind of walk down the aisle of the bus and ask me a question. And then around the start of the race, it's kind of the same. I don't run off to, I may go to the coffee shop, grab a coffee, or, well, in a pre-COVID world, I don't know how it goes now, but go grab a coffee or whatever, then come back and just kind of be around. And a lot of times questions from you guys just happen organically during that time, conversations around nutrition for the day, bothersome back, whatever the issue is.
Just before you go on,
it's off to the races.
Yeah, just before you go on to the race, I was just thinking then this is quite a special thing that you've picked up along the way, because quite a lot of staff and particularly doctors I've worked with don't necessarily get that fact that being around, accessible but not in your face, is a very, very special thing to have. Because often if you don't see the doctor, sometimes it's just a bit too hard. It sounds weird to just reach out and find them or check on something because you haven't seen them. You're just like, I'll just deal with it. And by then, by the time you get sick, it's too late. You're out of the race. You've missed that window. So I think that's a very special thing that you've cottoned onto. But what I was just thinking then, I don't know whether this is, you can answer it on both sides. Do you find now that because you're accessible, that people may reach out to you when they don't necessarily need it, looking for an excuse, looking for, those types, you get them in all walks of life where they're not really crook, but they just want a bit of love and you know what it is. So there's that side to it, but then there's also the other side. Have you seen it when you've been in that situation, you've caught something before it's really gone on, and thank God you were there?
Yeah, both for sure. And I think it's a real balance. And I don't always get it right in terms of being present versus not in your face versus fine. But like it's a moving target, and I try. But I do think there are downsides to being too present. Yeah. And I've heard that from other doctors, like they try to actually be a little more distant. And there's downsides to being right there in your face and kind of pinching you and listening to your lungs all the time. And, there's a very old school European thought process within cycling where the doctors are just kind of constantly running up and measuring you for different things, right? Like weighing your food and pinching your side to see if you're getting fat and all that stuff. So the spectrum is big in terms of how people address it. There's definitely been some times where I've picked up on things because I was around or had, like you mentioned, somebody just come to me probably a little sooner than they would have otherwise with something that was consequential. And that's the ideal. Like that's what we want. There's definitely times I think where some people either just need an ear to kind of not lay an excuse on, but there's certain things you can tell the doctor that you can't tell the director. Sure. Right? So for me, oftentimes I'll sit and I'll listen to some problems that somebody's having. And, it may not be the kind of thing where, like, you guys know I'm caring, but I don't think I'm a pushover. Like if, I'm going to tell you, well, that kind of sucks, but I think you can ride through that one today and, come back to the car if you need anything, I'll be there. I think as doctors, we sit in kind of a special spot there where there's a little bit of confidentiality, a little bit of, we're a bit removed from the competitive aspect, I guess, the way that everybody else is very much into how you're going to perform that day. Maybe we're a little bit of a safer spot. I don't know.
No, it's interesting. That's definitely true. And I have that relationship with you just because I think, for me, it's got a lot to do with your physical appearance, actually. I was just thinking about it now as I look at you down the computer, is that you're a fit-looking guy. You take care of yourself. So for me, to ask someone who's completely out of shape or very old or something like that, there's that knowledge side of it, but I get the relationship with you is that whatever you're doing looks good, what do you got for me type feel, like that's how I like to talk to you is like, and I think that goes a long way. And then also, like you said, you've got to have that listening ear, that trust, and also that you've got to have that ability to say, no, I'm not buying that, mate, because that also creates respect too. I think once someone pulls you up and you respect them, you respect that too and you go on.
Ultimately, my job is to get you guys out there on the bike and doing what your profession is, right? I mean, and sometimes that's going to be a hard day. And it may be when you're not perfectly tuned up to do it, but it's totally safe to go out there and contribute what you can. And that sometimes is a hard distinction to make, but one that hopefully y'all know that when I make that distinction and say, no, you can ride with this, and I think you need to today, that it's with your best interest in mind. It's not always easy, but for you, but it's what has to happen that day sometimes.
Let's go back to what you're talking about now. You're about to step into the car and follow the race. Run me through what that is like for you as a fan and as a doctor.
Yeah, so as a fan, I would say the first couple races for sure, it was just exhilarating. And I tried to hide that. I remember going to the Tour de Suisse, which was my first race, 2011, first race on the world tour. And it was guys that I ended up working with for years later, but that I'd only seen on TV until that point. And so, I knew I was a little bit starstruck, but I knew I couldn't let that show. Like, I had to separate being a professional from being a fan. But what was nice is when I was in the car, I could kind of be a fan, right? Because you got the team was on the road, and I could sit back and look at the bikes and
but you couldn't
try to catch a glimpse of the race.
You couldn't make reactions though in the car, like, whoa, look at that. You couldn't do stuff like that.
No, I had to be totally cool. Now there's much less of that because I've spent just so much time in the car that I won't say there's none of it. I mean, there's still, going up Alpe d'Huez or going across the cobbles in Roubaix. There's times that are just amazing. And I'd switch into total fan mode, absolutely. But you even see it in some of the directors. We hit these iconic places in Europe, and the race is being defined at the moment. And you can see some of these guys, they're very much doing what they need to do for their work, but you can tell that it's a little different than it was 10K ago. And that's fun.
Cool.
So there's that component. But the majority of the time spent in the car it's really boring. And I don't mean that in a bad way. That's kind of a good thing. I always joke at these races, if my week or 2 weeks with you guys is pretty insignificant, if I'm not doing a whole lot, that usually means the team's doing really well.
Yeah.
So I'm fine with it being boring, and I can kind of watch a little bit of the race and talk to Charlie or Juanma or whoever's driving, and we have a good time, but it's pretty relaxed most of the time.
All right, well then tell me about when it suddenly doesn't get relaxed and there's been a crash on the road. How do you approach that? Because one team doctor I used to have in Mitchelton, he was an ER doctor, and he was very good at, one of his best skills I think was when we had a crash and you were freaking out, you're all full of emotion. His name was Serge. He used to come up and he'd just make you feel calm. He'd been in that situation a million times. And that's something I really loved about him, is that nothing could faze him, because a cycling crash was just So run me through what happens to you when we pull up in the cars, and what happens when we all go down.
I will say Serge is great, by the way. He used to work with this team.
That's right, he did, yeah.
No, I'd say, as you said, it suddenly becomes stressful. We may be mid-bite of a sandwich and telling a joke, and then all of a sudden it's on, right? There's been a crash or whatever's happened. So for me, I do think having a background in emergency medicine is helpful, because if I'm mid-bite of a sandwich, I'm not going to throw my sandwich down. I'm going to wrap it up as the car pulls up, grab my bag. It's all you try to stay calm. They teach you in medicine, there's something called a code in the US, which is when somebody in the hospital has lost their vital signs, they've died, and you've got to go do CPR. They say never run to a code, because you get there, you're short of breath, you can't think, your heart's pounding. And I take a little bit of the same approach. We pull up, I'm going to get my bag, calmly but quickly move to wherever you guys are. First, see if we're in it, because we don't ever know until we get there whether we have riders down. But if we get there, I'll usually either wait in the car and the mechanical signal for the doctor to come out, because we don't want everybody on the road. Or if we know from the TV or something that one of you guys is down, it looks like you need us, then it's straight to you guys. And then it's kind of the same way we do with any car accident or anything else. It's big picture. You don't want to run in and just focus on what's going on. It's big picture, where the car is coming from. Are there still bikes coming? Who else is down? Is the ambulance trying to get through? Is the scene safe, so to speak, as I come up on you? And then we can kind of focus in.
Is it difficult not to, just hearing you say that, is it difficult not to get sidetracked by the race and the pressure that maybe the rider's putting on you, or maybe the director, or maybe another director, come on, get him back in the race, whatever, the mechanic's getting the bike ready, you're like, hang on, big picture here. Is that difficult not to get sidetracked by that?
It is difficult, for sure. I think the more I've done it, the less difficult it's become because I'm more comfortable with it. Early on, that was very difficult. Now, I feel very comfortable with kind of knowing what pace is appropriate. You know, if we need 10 more seconds to just make sure the rider's okay, I'm going to take that 10 seconds. And I'm not usually very gruff or confrontational, but I can be when I need to be. And that's the kind of thing where there's been one or two times where I've just quickly laid down the law and said, no, this is what's happening for the next 10 seconds, back off. Everybody's goals are the same, right? Even the directors who are pushing to maybe get you back on the bike or whatever else, it's not for your harm, it's for your good in the race, right? They just have a different take on it. And so when we get back together, we realize everybody had the same goal, your health and your performance in that order, but because of where we come from, we address it differently.
Has there been situations where you've looked back on it and gone, I wish I'd taken a little bit more time there, back in the beginning maybe when you felt a little bit intimidated? For sure.
And I would say there's probably even been some recently. I can't think off the cuff what those are, but the point being, me nor anybody else, we're never going to master this. It's kind of a work in progress, and every situation is different. So whether it's in the hospital or on the side of the road, there's always things that you can debrief and say, okay, maybe I could have done that a little better or this a little better. When you stop having that approach to it and think, oh yeah, I nailed it every time, that's when it gets dangerous. That's when it gets to be that hubris. You're flying too close to the sun when that's the case.
Well, moving forward, and this is, I think, the most common injury in cycling, and I do want to ask you what you think the most common is, and you can tell me now, but I think gravel rash is obviously, every time we go down, it's almost impossible not to have your hip done, your elbow, shoulder probably as well.
Yeah.
When we get back to the bus post-crash, if you couldn't finish the race, you get taken away in an ambulance normally, so that's another situation. But I'm talking about we jump back on the bike, we get to the finish of the race, and now we're in, I call it the travelling hospital if you've crashed. You're in the back of the bus, and the doctor opens up his little bag of the necessities to try and fix you. Run me through what that's like for you, and the first time that sort of happened, was it funny for you doing that, or is it just sort of like, you know what, that's just what I have to do?
Oh, no. It's fine. I mean, it's it's very much part and parcel of the job. And I mean, how many times have you just shredded your hip? Most of you guys have scar on top of scar on top of scar.
I wouldn't. That's what I said. Literally every time I crash, there's no way you don't do your hip. It's almost impossible not to scratch your hip. So however many crashes I've had is how many hip scars.
My 10-year-old is already starting to have like those permanent dark spots on either hip from crashing. It just comes with the territory. No, for me, first and foremost, it's looking for any injury that's worse than just that, what you call gravel rash. We call it road rash in the US, but because that's fairly superficial, it hurts, it sucks, we're going to deal with it. But I want to make sure that there's not a chipped bone underneath, a laceration that needs sutures or sewing. Anything else going, a head injury that may be hiding. We may be focused on the hip, but actually your head hit pretty hard. So once we've kind of handled or at least assessed some potentially more serious issues, then it's a matter of getting that rash just cleaned up. I mean, first and foremost, you got to get the gravel and the dirt out of there. There's no perfect way. In fact, there's no perfect way to handle road rash. You'll find if you get 5 doctors in a room and ask what the best way to handle this is, you'll probably get 6 answers. We just don't have the perfect answer. But getting it clean is hands down. All of us will say you got to get it clean first. So for me, we've got showers on the bus. I will typically hand you guys a surgical scrub that has chlorhexidine and a little sponge on it. Chlorhexidine is an antiseptic cleaner, what we use before we go in to operate, and just have you get after it in the shower. There's no use me coming in there with you. There's no use me scrubbing anything. Most of you guys are pretty used to doing it at this point, and quite honestly, do a really good job.
Well, you learn, to interrupt you there, you learn the hard way because the first few times you do it like a bit of a pussy, and you don't really scrub it that hard. You're like, yeah, that's clean. And then you come out and the doctor goes, now I'm going to have to clean it. And after the first time that happens, the next time you go, I'm cleaning the hell out of that myself.
Yes, exactly. And it actually hurts less the closer in time that you do it to the injury. So like if you were to get right up and just scrub it, it probably wouldn't hurt that much because all those nerve endings are deadened. And I mean, it already hurts, but it wouldn't hurt worse. And so the sooner you can get in the bus, scrub that thing out and be done with it, the better. Now, to be fair, you've probably been among the group that stands just outside the shower and kind of chuckles as we hear the guy in there just cussing and screaming. But it just is what it is. And we've all been through it. You know, I mean, even me as a doctor, being a recreational cyclist, like I've done it too. It sucks. It's going to be what it's going to be. But you get it clean. And then assuming it doesn't need sutures or anything like that, it's a thin layer of antibiotic ointment, a covering, and you know that can be like a Telfa nonstick bandage. It can be a much more expensive plastic surgery or dermatologic type thing. There's no evidence that any of the more expensive stuff really helps speed or increase healing time. So we go with, you know, I won't say basic, but just kind of the nonstick bandage, antibiotic cream, tape on top of it, and then usually leave that for 24 hours. We'll change it, leave it again for 24 hours, and we start to let it air out because eventually if you just let it stay moist, it's not going to heal nearly as quickly. But we have to balance that against you need to sleep, and if we leave it open, it sticks to the sheets and all that keeps you awake. You need to be able to ride, and if it's getting really dry and tight, that can be bothersome on the bike. So I'd say everybody's course timeline is a little different, but that's the nuts and bolts of it.
Tell me about this idea, and I've done both. I've done exactly what you've talked about there and probably stick to that more recently. But in the past, I also used to use a thing called Opsite, which is more or less like a plastic covering that goes over the wound, and inside all this mucus pus builds up in there. And miraculously enough, you know, I changed it probably 10% less than, you know, the other one every 5 days or so. And it was so weird that every time I pulled it off, it was healing under this fluid. And that's what I found so bizarre. Do you believe in that sort of healing process?
Yeah, I do. And I do think it works. It delays healing a bit because of it, but it will still heal for sure. And depending on the scenario, that may be a good way to go. But just for every crash, I don't think it necessarily makes sense. A lot of times, that first 48 hours is rough. And then if we can get it dried out a little bit and healing out, you guys almost don't notice it. Now, not the real deep ones, but the ones that are just kind of run of the mill. We just got to get you through 2 days and then you're good to go. That type of treatment can drag out. And so it can drag out the healing. So then it's just a matter of picking and choosing which way to treat which injury. And that's where it's a little bit of a black art, I guess. I mean, there's no accepted way to do that. We just do it based on our experience and history.
So just say a guy has actually got to the end of the race and you've assessed the injuries. There's nothing there that is a definite no. For instance, like broken leg or, you know, a serious concussion. But it's grey. It's border. And the rider's not too sure to go ahead. The director obviously wants him, or the team wants him to go ahead. Who does that decision come back and lay on? Is that your decision, or is it a combination? Where does that go?
The final decision on our team is up to the doctor. That said, I can't think of but maybe 1 or 2 instances where I've just laid down the law and said, this is what's happening. I try to make that a much more shared decision. And oftentimes, say it's like this. Somebody crashes 30K from the finish. They don't have a concussion, don't have anything broken, but they're pretty banged up. I will often try to get them to the finish, get them to ride to the finish, and just say, look, if you can make the time cut, then we've got all night to figure out whether you start tomorrow. You know, it doesn't mean because you get there you have to start tomorrow. Let's get you there, and then we can kind of take a breath, see what's going on. And so if we can cross that line and not get time cut, that buys us so much time in the evening to kind of step back, treat some wounds, get some physio work done, some chiro, even reassess the next morning. You know, get on the bike for a little warm up. Can you handle the bike okay? Do you feel okay on it? And take the start line. And even once you take the start line, I mean, if you get 20K in and it's not happening, then pull the plug. Yeah. Nobody's going to be mad at you at that point because you certainly gave it your best. So I try to take a little bit less of a defined approach, as in the decision has to be made now, but take it instead as is it smart and safe to like push it out a little bit, buy us some time, take this little by little? Because I've also seen a number of times where guys have pulled the plug either in a race or right afterwards, like I'm not starting tomorrow. Like they start packing up their stuff, and the next day, like actually I don't feel that bad, you know? And that's awful for everybody involved. You guys don't like that when that happens.
No, I was about to say that's probably just really good to hear that. And I know that fact myself, but even in the moment, it's very difficult to see that far ahead.
Sure.
You're feeling the pain. You quite often when those crashes, this is personally for me, when I think about those crashes, not many of them happen when you're really sort of comfortable in the race. They're at the pointy end, you're really on the limit, you hit the ground, everything just comes to the forefront. The pain, you're out of breath from the race and everything, and you're just like, I'm out, let me out of this. But
sure,
when the dust settles and, for instance, you get to the hotel that night, you're like, oh, geez, I'm glad I'm still in the race because I want to go on. The worst thing would be, God damn it, I didn't push on. What I wanted to ask you there was, is there any benefit to actually riding it out? You know how there's this sort of myth, I guess, like, yeah, you ride it out, you keep it moving, you know, you loosen it up. Is that actually work?
I think so. I mean, I don't know of any scientific studies that address this. I'm not sure how you would. You take 20 riders and take half of them and throw them on the ground and then put them back on a bike. Like, you couldn't do it ethically. But it kind of makes sense that the movement is going to be good for the muscles and tendons, right? Just to kind of, cycling's great for that. You know, running is very impactful. If you say, just run to the finish, like that can be a little harder. But if you can get on the bike and kind of easy spin and still make the time cut, that's a pretty therapeutic movement. And in addition to the biomechanical, like moving of the muscles and tendons and joints, you've also got increased blood flow and your increased lymphatic flow. And that's what gets rid of swelling, inflammatory cells that kind of build up. Like, it just keeps things moving along. And so I think it's reasonable to expect that is a very beneficial thing in some situations. If it's appropriate to do, to hop back on, spin for 10K, 100K, whatever it is, but get things moving.
Getting back to the hotel, we've all got back to the hotel, and this is not necessarily all to do with crashes, but there's a big part of that. You've had a fall, maybe you haven't got gravel rash, you've just got aches and pains, but also we've got aches and pains from just riding the bikes in terms of physical. What's your approach, and how do you fit into that mold with recovery? And I'm just thinking off the top of my head, ice bath, cooling, opposed to, say, taking an anti-inflammatory tablet, something I've moved away from. Early in my career, I just sort of thought, you just got to have a tablet to fix something. But then I've realised that, hang on, there's a better way to do this. What's your idea once we get back to the hotel and addressing this?
Yeah, that's great insight. The anti-inflammatories and medications that we have serve a purpose, but a lot of them have a downside as well. And we want to balance that. If there's a way to get the same beneficial recovery from ice baths, massage, dietary interventions, and do all that without pharmacologics, then that's typically a better way to go. But I mean, there is a role for the anti-inflammatories as well. It's just knowing when to use them. So a lot of times it is, in this scenario, we've got the rider bandaged up, cleaned, everything on the bus. So they're going to go for massage. They're going to go, for dinner, going to rest in the bed. And by rest, I mean like between massage and dinner, you guys, basically, if you're not on the massage table, you're in bed, feet propped up, hanging out, getting ready for the next day. So I'll often try to come around probably after massage, before dinner, check on whoever's injured, see if they need, we'll assess medication needs, things like that. We'll probably try to delay those until bedtime, medication maybe to help you sleep, like an anti-inflammatory to just help with the pain, or paracetamol, Tylenol, to keep the pain level down to help you sleep. But assess that as we need to. I'm involved in a lot of the nutritional components, and even talking with the physios, the chiros, the soigneurs who are working on you guys, but that's often behind the scenes. So, maybe a soigneur works on you, and I'll afterwards go by and be like, how did this feel? How was that? How are they doing with this? We help put together recovery protocols for the soigneurs to implement. Oftentimes the doctors are talking with the chefs on what might be an appropriate meal plan. Not always, because our chefs are fantastic, but high level, we're kind of involved in all that, not necessarily overseeing it, but more like a team member, I guess.
Thinking back now, and this is maybe a little bit outside of crashes per se, but I'm thinking about now, back in the hotels, recovering 15 years ago, before I was racing and before you were a doctor, but I guess you've heard stories, or you may know what it was like, or can think about what it was like. What do you think has really changed over the last 15 years when it comes to preparing riders, making sure they're recovered? I think even in my career, there was a big push on oral vitamins early on in my career, and which has completely drifted away now. And to be honest, I think back then and how many vitamins supposedly I was helping me, I was just swallowing pills. And actually in the end, I was like, my bloody livers can't take any more of this, like that was an idea, because once the intravenous stuff was drifted away, there was like, well, let's try and have it orally. And then now we've almost gone back to a wholesome sort of way of eating. Is that something you've seen happen over the last 15 years? What do you think?
Oh yeah, absolutely. The no needles policy and the no IVs for recovery, that started on our team. And now is an International Olympic Committee rule. I mean, it made its way up to the UCI and then the IOC, and it's something that started here, which I didn't start. I came in as that was getting started, but I think the team can be really proud of that, because the science shows that those intravenous recovery treatments are just totally unnecessary. They're not helpful.
We're not talking about actual illegal doping here. We're just talking about simple recovery. Yes, which might be what?
Right.
Saline,
some vitamins, B vitamins, kind of what we call a banana bag, because it looks yellow once you add in all the vitamins. Something like that. Totally benign from a doping standpoint, certainly not pushing any of those boundaries, but also could be kind of an open door for some of those things.
Sure.
If you get used to having an IV after every stage, then it's easy for either a nefarious doctor to put something in there that you don't know about, or for it just to become kind of a snowball. Well, why don't we add a little of this or a little of that? You're doing it anyway. And what we found, or what science showed, is that even the simple saline and vitamins really wasn't necessary for recovery. If you're truly dehydrated to the point where you might need to go to the hospital, yes, but just day to day, we don't need it. So I think you're right. There was a response to that was, well, let's see how much we can take orally. And that was misguided, right? I mean, that also isn't necessary. What we've kind of landed on that you alluded to is this realization that the foundational principles of diet and sleep and nutrient timing and those things, those can make a big difference. And there's certainly nothing sinister in any of that. It's just science and figuring out, when to eat what and what you should be eating to recover, what type of recovery modalities are helpful, whether that's massage, ice, foam rolling, compression, and really optimizing those things besides going to IV therapies and medicines.
Yeah, I think it's really interesting, and I think just listening to you talk then, I think there was a massive placebo type effect, which still would exist now with certain things. But I think back, if I wasn't having all those vitamins, or I can imagine back in the time, if you weren't having that intravenous injection, like you just said then, there wasn't much benefit in it, but psychologically you thought, wow, I'm good now. I'm going to be good. And it's funny how it's drifted out now, and we've actually just got back to natural things. And maybe I am getting a little bit too caught up in the whole sleep aids. And something that I do as well now is try not to check those things before the race, because you can psychologically get caught up in that now. If I haven't had a good sleep, I know how important it is, and I'm seeing this data now which can psychologically inhibit my performance.
Yeah, I think we partnered with Whoop this year in the team, and we're able to see that sleep data every day. And I think that's fantastic, and that data is very usable in lots of scenarios. Race morning is not that usable. If you wake up with a poor recovery and a poor overnight sleep, you still got to race, and you're still expected to do just as well. So I think the take home in those scenarios it's really important to look at trends, not one night here and there, but look at trends. And even during a stage race, one of the things that I've seen with some of you guys in the past is I won't worry about one night of sleep that's poor, and sometimes not even two, but if we start to see a trend toward 3 or more, I'll go talk to a rider and say, hey, what's going on? Are you watching movies late? Are you having difficulty sleeping? Are you eating too much right before bedtime? Are you not eating enough? Like if we kind of attack some of that and add, like start the trend going back the other way, you add 30 minutes of sleep here, 45 there. It's actionable data during a race, but with a bigger picture, not just for that one day. And that I found to be useful. That's
what I was about to say. For me, it's become a really good training tool because I can control that stuff outside of the race. And it's been a really good data recording system in a race, like I said, because a lot of that stuff you can't control to a degree. So it's been great to look at that stuff post-race and then go, okay, how can I fix that in training now? I've just got a couple questions left for you now. One that's very current. What do you think the impact of COVID will have on the World Tour racing? And what's the impact it's having already now with the protocols? And what do you see the future? I mean, it's very hard to predict, but you're going to have a much better idea of that than the rest of us gomads out there.
Yeah, I mean, I think it is hard to predict. I've been really impressed with how well cycling has done so far, pulling off these races, maintaining healthy riders and staff in the race. So kudos to the sport. I'll be frank that they've done better than I thought they would. It's a difficult thing to navigate. I'm not quite sure how it's going to look next year. I imagine a good portion of these regulations will carry over. Maybe the testing, certainly the sanitary regulations. I think we'll see face coverings, masks around for a while, at least until there's a widespread vaccine, I would think. With that, there's going to be required distancing from the fans. Things are just going to feel different, I would guess, for another 18 months or more. But that doesn't mean that it's not going to be slowly moving back towards some semblance of normal. I also think whatever normal we arrive at is going to be different than what we're used to. I don't know. I think it will be pretty impactful. We're also seeing just with the financing of teams and the companies that support cycling, because of the way cycling has built its financial structure, teams are totally reliant on outside sponsors. That's really difficult for a lot of teams at this point because those sponsors are big companies who are often taking financial hits in their year. And if you look at cycling as a fairly discretionary marketing expenditure, it's potentially one that gets nixed pretty quickly in the rebudgeting.
Yeah.
So, I hope that we don't see that as a widespread issue in cycling, but it's certainly something we have to consider.
I think what you said there is that we'll get used to, there will be a new norm, and I think we'll be used to that by the time it happens, and you will have to literally go, well, what was it like before? Because it'll be a slow progression. And even like this year's calendar now, it's sort of in a weird way feels normal all of a sudden, like when I saw this on paper, I was like, this is going to be insane. And it is insane, but it's weird how normal it's become very quickly.
Well, I think our pendulum swung so far the other way during lockdowns and quarantines that to come back out, anything that we're able to pull off in cycling or even just in day-to-day life, going to the market, feels normal because there was a period of time where we couldn't do any of it. And so, and I don't think that's bad necessarily. It's just, it maybe even helps ease the transition. I also don't think it's all doom and gloom. I think, we've come out of every pandemic in the past and we'll come out of this one. It just remains to be seen kind of how that looks. But I have every expectation that in 5 or 10 years we'll be at a very regularly functioning new normal. It won't look like it did 5 years ago, but we'll just be ticking right along in some manner. But it's going to be a bump in the road between now and then.
I've got a juicy question for you to finish on. Saddle sores. This is probably the most common problem, I guess, for every cyclist out there, and the most maybe unspoken thing is that everyone has their own little saddle sore. They're very different things. How much experience have you had to do with them? And what is your general advice you can give with saddle sores?
Lots of experience with saddle sores. It's one of those things, as you say, a rider will often come up and be like, hey, Doc, I've got a question for you, kind of quietly, let's step to the side. And I was like, man, I've probably dealt with this 3 times today already, right? It's not a big deal, and it's common. Not that frequently, but it definitely comes up. And even in the recreational community, I'd say probably even more so than you guys. Even though your time on the bike is so much greater, a lot of recreational cyclists, when they bump their mileage just a little bit, will suffer because they're not used to it. Maybe their positioning's off, or they're not as tough down there for
exactly. They haven't got time
in the saddle.
Yeah, they're not leathered up yet.
So it's really common. I think the best advice is right up front when it starts to present. Like you can kind of tell something's brewing and it's painful. Maybe there's a little bump. If you're able to take the time off, so obviously not in a race, but in a training period, if you can take a day, 2 days off and just kind of let it rest, often that's all it needs, right? Just give it a little time. So that's typically the first thing I'll recommend to you guys is soap and water, keep it clean, maybe a little bit of like very, very thin antibiotic cream or ointment. You don't want to go too thick because you don't want to clog things up again. Just real thin, and then let it air out. So, loose fitting shorts, stay off the bike for a couple of days and you'll probably be just fine. When it gets beyond that.
Yeah. I was going to say, don't go squeezing it. Don't go get that pus out.
Don't do it. If you want to hold like a warm cloth to it or something, but you don't want to just squeeze it. And typically early on, it's just red.
Yeah.
Right? Like it's just kind of red, irritated. And that's when you want to catch it before it turns to have that pus pocket. If it starts to go beyond that, then a little bit of hydrocortisone cream or a steroid cream can be helpful. Again, when it's just red, if it's massively infected, don't put steroid on it. It'll make it much worse. But if it's just irritated, kind of the early stages, a little bit of steroid cream, and again, staying off the bike if possible is the best thing for it. Occasionally, we've got to open them up and drain them. I've only done that 2 or 3 times in my 10 or 11 years with the team, but it does happen, and it's not fun for anyone involved.
What happens then, though? Once then you've just got a small cut there, and then they have to ride on. Like I've obviously had many cuts there, but they've just happened because I'm riding, not necessarily because I've had to have it drained. Is it dangerous then to go riding, or is it less painful? What's the experience there?
Yeah, typically if it's been opened, I will recommend the rider not ride. Like it's time to just come off the bike. There's been one case I can think of where we opened it and let the guy keep going to finish, I think 2 days of a grand tour. Like it was almost done. And we just kept a close eye on it, antibiotics, all that stuff. But typically if we've opened it up, it's game over.
Well, mate, that was very juicy, and I hope that didn't gross too many people out. We've got a ton of questions that have come in, and I haven't had a chance to answer all of those, but it's been great to sort of pick your brain and give a little insight to what your day-to-day life is, apart from some little tips and tricks of the trade there as well. I forgot to mention the actual name of your podcast at the start of the podcast, The Podium. Do you want to say a little bit about that so everyone can get across there and listen to that? Because I really highly recommend that to everyone who's listening here. Kevin does a fantastic job there. I've used it a lot for my own hacks, and it also appeals to everyone from all different levels of cycling. So tell us a little bit about that before we sign off, mate.
Yeah, thanks, Mitch. Yeah, it's called The Podium. My practice is Podium Sports Medicine, which is why we moved to that name. And yeah, we're 2 seasons in, about to launch our 3rd season, and in each episode we delve into a different topic around performance, from different supplements to training strategies. We do some on sleep, recovery. So it's 45 minutes to an hour, not too deep a dive into topics, but scientific without being overwhelming, and hopefully give everybody some actionable things they can do to improve what they do day to day.
Yeah, great, mate. Well, thanks very much for coming on Life in the Peloton, and I hope to catch up with you soon. I can't imagine we're going to see each other this year, but I guess until then, mate.
Hopefully soon. I've got my fingers crossed for a March ride in Girona, a little coffee ride with you, and I'll keep my eye on that.
Sounds great. Thanks, mate.
Awesome. Thanks, Mitch.
Well, there we have it. Dr. Kevin Sprouse. I think he gave us a pretty good insight there to a lot of things, especially saddle sores. I hope it didn't get a bit too gruesome there for everyone at the end, but I was like, that was the most commonly asked question, and it's a big problem that I have myself. So I was like, well, let's go there. Let's get right into it. What did you think of the juicy stuff there, Lionel?
Well, I'm a bit squeamish, I must admit, and I'm listening to the talk about the riders having to scrub out their own wounds. I've kind of heard a few stories about that before, and just the nightmare of not doing it properly and then having to get the doctor or a soigneur to do it. It's one of the occupational hazards, isn't it? The road rash, it's got to be cleaned out properly, otherwise, all manner of infections could take hold, couldn't they?
Exactly, and it's a common thing. Like, we have it so often. Like I said, every time I crash, you're very, very rare not to have gravel rash when you crash. And you learn very quickly that it's best to do it yourself at your own pace, your own pressure, because once those doctors get in it, they obviously can't feel the pain. So they're like, I'll just do what I need to do to clean it out. And it is hell. So, yes, it was a nice little insight there to what really needs to get done, because I'm sure a lot of people out there are going through those situations themselves as well.
Yeah, the other thing that struck me listening to Dr. Kevin, as I now think of him, talking about the job, and particularly being in the team car, and when crashes happen, it really struck me just how important it is to be a calm, collected person. And I suppose the medical profession does attract, or people who are kind of calm and methodical and logical would graduate towards that kind of profession. Obviously, there's an awful lot more to it than that, all of the medical knowledge and study and everything gained over years of experience. But just hearing him talk about how a doctor or in an emergency room, they're told not to run when they hear a certain code because they don't want to arrive and be working with a patient who might be in a pretty critical condition. They don't want to have their heart rate elevated and be out of breath and kind of, shaky, sweaty hands and all of that. And just that sort of logic and the methodical way of working. And I really had a picture of, we all know the kind of the chaos and danger and drama when there's a crash in the Peloton and all the team cars stop in a hurry. And I just had this picture of Kevin, carefully folding up the foil around his sandwich and getting his bag ready and waiting for the mechanic to maybe give him a signal that one of his riders needs some medical attention. And I just thought how far removed that is from my own temperament. I'd be the complete opposite. I'd be in a total panic. I'd be, swinging the car door open and causing more harm than good. And I found that a real kind of interesting insight. And I guess, when you've hit the ground, Mitch, it's not something that the riders like to dwell on too much, but, that gives you a real shot of adrenaline, doesn't it? And you kind of, heck, where am I? And you just need that calm, reassuring presence around you. I'm sure it's really reassuring.
It is. It really is, because you are quite aggressive. Well, I get quite aggressive. Get me on the bike. I need to get back in. And they they don't necessarily need to say anything, but just the calmness washes over you when you see them not reacting to any of that. They don't get emotional back at you like, oh, calm down. They just, that's all right. And it's very funny how quickly it washes over you. When you're on the ground, it does feel like forever. It really does feel like 10, 15 minutes. Ultimately, it's 1 or 2 minutes at the most. And if you don't have someone to calm you down in that moment, and someone else who is ultimately taking that on board and getting more aggressive, things just spiral well out of control, and that's definitely not what you need at that moment. So it was very nice to hear him say that. I'd never really thought about it, but actually as soon as he said that, I was like, that's exactly right. And I spoke about Serge Nimke, our old team doctor. He was amazing at that, and he was the man on the scene for me at my crash at Paris-Roubaix. And afterwards, was with me in the hospital all through that very traumatic time. And it's very funny that I look back on that very fondly because of him. He made it so comfortable for me. He made everything feel okay and just took control. So it's a big responsibility these guys have, whether it's at the hospital, at the race site, or like he spoke about, just talking to you, having another ear to listen to, opposed to a director. Maybe you've got these concerns. And I like that he did also say that I'm definitely not a pushover either. Sometimes I might tell you, you've just got to push through that pain today.
That's interesting. I also thought it was interesting, and I wanted to ask you, Mitch, about the relationship between the riders and the doctors. Have you ever been in a position where you've been able to talk to a doctor about something that you maybe wouldn't want to let your teammates or sports directors know? Because I guess, the sports directors are focused on the sporting performance. They need everybody to be able to, to do the job on the bike. But there might be a time where you don't necessarily want to let the sports director know that you've got a little issue that you that might be troubling you or might potentially hold you back.
Not exactly that. I can't remember off the top of my head me ever having to say that. But one thing that I do use a lot of the team doctors for is just family needs, family questions, whether it might be about my wife or my children, because we're living in a foreign country. It's not as easy just to go down to a normal GP and ask them and get that reassurance. You need to have someone who speaks English and understands exactly what you're talking about. And quite often than not, whether it's on a race or I might even just call them up and just ask a question before we then go to the hospital or whatever might need to be done, I just go, what do you think? This is happening at home. And that has been an amazing thing throughout my career, to have those doctors, whether that was back in Mitchelton or then recently in EF, with English-speaking doctors that I really trust, that I really have a good understanding for, that could give me advice on pretty much home matters, or even just myself. If something's happening to me that's not bike-related, sometimes it's a bit embarrassing talking to someone else about it. So it's nice to talk to the doctor about those sort of things too.
And lastly, one of the kind of big stories recently has been the issue of concussion, and certainly professional cycling is becoming more aware of the short, medium and long-term dangers of concussion and head injuries. It's something that sports like rugby and American football have had to confront as well. And certainly we saw during the Tour de France, Romain Bardet hit the ground hard and finished the stage, and then it turned out overnight that he had a small bleed on the brain. And even in this Giro d'Italia that we're watching now, your old teammate Mitch, Peter Weening, hit his head pretty hard in yesterday's stage and pulled out today. Now, when you crash, I mean, as a rider, what's your attitude? You were saying that you want to get straight back on the bike and get back into the race, and obviously, the doctor has got to weigh up whether or not that's safe for you to continue.
That's right, and there's not a whole lot of time to do a concussion check on the side of the road, or even an accurate one, if there is one, that you can do in a few seconds. A good example for me, and I've been a little bit more aware of concussions since having pretty heavy brain trauma myself early in my career, that I was just a bit more aware of it, and that I understand the consequences of this. And a few years ago in Milan-San Remo, I crashed in the feed zone, and Taylor Phinney was right next to me when I crashed, and I smacked down on my head. The helmet was broken, and we naturally got on the bike, pushed on, went over the hill and down onto the beach, heading towards the finish. And Taylor had the knowledge to just go to me, I'm just going to ask you a few questions here because I saw how you crashed. And he did a mini concussion test on the road, and he just goes, I don't think everything's right here. And he went back to the team. I was like, push on, I'm just going to push on, I'm fine. He went back to the team, and the team actually instructed me then to stop at the second feed zone. They said, there's no point in going on here. We're not going to gain anything. It doesn't seem like you're 100% right. And so what I loved about that was just that awareness from another teammate, because I think, like you said, on the side of the road in that crash, there's not enough time. But if your teammates are aware what's going on and they can assess how you're riding, or if you're a little bit out of sync or out of tune or doing something odd than you normally are, I think maybe it's best to step off the bike immediately at that point.
And did you have a concussion check afterwards, or did you wake up the next day feeling okay? What was the upshot of that?
I didn't actually have a concussion check afterwards. I flew back and I didn't feel odd. That was also the next thing. I was checked on by the team doctors. They gave me a call the next day and ran through some things. I didn't have any symptoms at that point. That's not to say they mightn't have had something minor. But I think at that point, like we said, I wasn't going to gain anything in that race. I'd sort of lost a bit of confidence. Once that thought had drifted into my head, I was just sort of following the wheels at the back, and I wasn't going to be much of a help to the team anyway. So we weighed that up and said, he's not really going to be helping the team. Potentially he could have a concussion let's just call it quits at this feed zone. So I don't know if that really answers your question, but what I'm sort of trying to get at is just this awareness of what can happen, that the riders need to have an awareness themselves, but also of teammates of what happened in that crash. Is there something odd with this guy going on that he doesn't realise, even whether it's talking to them or the way they're riding, and just notifying them or someone else who can make them stop the race?
That's really interesting. Yeah, it's certainly something that I'm sure riders in the cold light of day they would want a teammate or just any rider in the bunch to look out for their best interests. But of course, when sometimes you're the least equipped to make the call on something like that, especially if you're the one that's hit your head, and the instinct is to carry on in the race.
Totally, and that's just the competition side of you just going, I'm okay, and you can't see any injuries on your leg or on your arm. It's just inside your head, so you think everything's okay, and that's the most common problem with concussions, I think, and even in the recovery process, I experienced that myself. You think, yeah, I'm fine, but actually it takes a lot longer than you think. I want to also speak about what's coming up on Life in the Peloton. Our first lot of caps sold out in about 5 minutes. I've finally organised some more casquettes. They're going to go live on Friday, so hang in there. After much demand and after some slow process in Italy, they've arrived. So thanks everyone for hanging in there, and it sounds like everyone is eager to go. I'm pretty sure there's going to be enough for everyone. Well, I hope so this time. So hang in there for next Friday. And guys, until then, thanks for listening. You have been listening to Life in the Peloton. The producer of this episode was Will Jones. The music in this episode was composed by Pete Shelley. Thanks, mate.